I would like to thank organizing committee to have the session on adolescent health and well-being. This session will be followed on the Professor Iskandar concept of people-centered care. He talked about adult and aging population. In my session, we will talk about adolescent health and well-being, how to co-create AIDS-free generation. I have a disclaimer, I'm a pediatric infectious disease. I'm more happy to talk about virus, bacteria, CD4, or viral load. But today, I would like to step back and talk about why we are working in HIV today. I think because we care about population, we care about adolescent, and we would like to be part of the co-creating of AIDS-free generation. So today, I promise I don't have any sophisticated research data as usual. But today we will have this session as an experiment, as a design thinking workshop in 25 minutes to talk about if we would like to create adolescent health and well-being in Asia Pacific, what should be done. So the first thing, I need participation. So everyone, can you bring up your phone? Okay? So let's think about what is the 3 words come to your mind when you think about adolescent. So please scan and think, what is 3 words that just come out of your mind? Please type in and share what is your thought. And then we will learn together about adolescent. Please, let's see what is the answer. Very good. I didn't see any scientific word here. Very good. Because we start to think about people-centered. We talk about fun, we talk about growth, we talk about change, we talk about hope, active. And we also have some concern. We still have some risk, innocent, difficult. So if we want to work with adolescents, let's see who they are. So by definition of World Health Organization, adolescence is a period of life with specific health and developmental needs and rights. Let's think back when you are 15 years old, how far it is, but think back of your 15 to 19 years old. It's time to develop knowledge and skills, learn to manage emotions and relationships, acquire attributes and abilities that will be important for enjoying the adolescent years and assuming adult roles. Please keep in mind, this is the adolescent. When you work with adolescent, there's still a process of not stay in a solid stage. They're still in a process of growing. How come we can work with them, acknowledging that they are in the process of acquiring skills, control their emotions, and also they want to enjoy the adolescent years. So the important thing when we work with adolescents, we not just focus on the cascade of HIV or the service delivery, but we also need to help them to grow and progress into adult roles. And if you talk about brain or some physiology, the important part is limbic system, that it's pleasure-seeking, reward processing, and emotional response. So if we want to do a touch point or get linked to the adolescent, we have to do in a positive way in terms of reward, room for improvement, encouragement, rather than make them feel stressed. And also in terms of executive function, prefrontal cortex, they still develop in decision-making, impulse control, and planning for the future. So the point is that the readiness of each adolescent is different. So we need individual care and also care about each individual. It might not be the cut-off at age or stage, but it's more on development of each individual. So during this talk, I will focus on 3 things. What is the definition of adolescent health and well-being? The second one, youth-friendly health service. What does it mean? What the adolescent want? And we have a special guest. We will have youth to talk to us. What is the youth-friendly health services in their mind? So we can design our service to meet their needs. And the last one is to share lessons learned from integrated youth-friendly health service some examples from Thailand, and I will keep the last 5 minutes to learn from you from different settings in the region. So what is adolescent health and well-being? If you see in the slide, when we put adolescent in the center, adolescent well-being means that adolescents thrive and able to achieve their full potential in the support, confidence, and secure and healthy relationships. So that's the center of adolescent well-being. We talk about health, physical health or mental health is just one domain. We need to work with the education, the schools. We need to provide safety and supportive environment. Especially the keyword is that non-discrimination and privacy. We also need to encourage them, empower them to learn and acquire job, and also develop resilience to be able into adult life. So when I prepare this talk, I come across with this paper. Do you have any chance to know this publication from the WHO before? Raise your hand. Only a few. I also just learned about it too. So it's the documents from the WHO and many organizations like UNAIDS, UNICEF to talk about Global Accelerated Action for Health for Adolescents, or called AHA. So talk about what we would address adolescent. And Dr. Tedros from the WHO Director General saying that our work to promote adolescent health and well-being cannot be success without making adolescents feel safe, respected, empowered, fairly treated, and duly recognized. And what is the adolescent health needs that they survey? The top 5. The first one is mental health. Second one is sexual and reproductive health, in which HIV and STI, that we are an expert in this room, just part of that sexual and reproductive health. And adolescents also wonder about how to access to free or affordable health care, because it's a big, big issue for adolescents who not earn money or not be able to reach healthcare services easily. And also the meaningful youth participation in health programs. And the last one is social determinant in health, especially gender inequality and discrimination. So during the talk, we will address all these 5 issues. So start with the meaningful adolescent and youth engagement. When we work with adolescents, we need to be engaged. And what does it mean by engaged? It can be inform them, consult them, involving them in the process, or collaborating with them in the clinics, or even empowering them to work with us with the programs or the health services. So I would like to start with empowering and involve them. So today we have honor to have Thonpai Pongsathorn. He is the representative from Buddy CU Clinic. He will come up and share with his thought about what is the youth-friendly service that adolescents looking for. Please welcome Thonpai. So Thonpai, what is the youth-friendly service in your mind?
Thanks for inviting me. Okay. We have discussed this topic about what. Sorry.
It's okay. Yeah. What is the youth-friendly service?
What youth-friendly friendly service is in 3 topics. That is friendly. You can be yourself. Okay, and the last one is the staff is kind. I'm sorry.
Yeah, the friendly service is friendly, kind, and you can feel be yourself.
Yeah.
And what is service that you want to have?
The service I want to feel like relax, feel heal, and be happy in service. We use we had we had a vote with our group about the best youth service, the youth friendly service in 3. That is no it's free of charge, and the one-stop service, and has staff that kind and be patient with teenager. moreover, uh, uh, mm, working so so I feel a little bit nervous.
It's
Sorry,
okay. It's
it's
okay.
okay. Mm, and the clinic, which operate in outside of the office hour, is also an important factor because some of us cannot go to the clinic in the office hours. Yeah.
Thank you. So we will try our best to design our service of what the clients needs. And the second question is that we are in this room talking about we try to work in our role to build an AIDS-free generation. So what do you think the role of youth in working together with us as a scientist, as a researcher or physician in this room to build an AIDS-free generation as a youth?
Okay. We spread the message to our friends, to the youth, and we I'm sorry, and we make sure that we are the safe space for and encourage them to come to the clinic. If the results are positive or you have some problems, you will treat, you will be treated immediately and free. The sooner you treat, the sooner you test, you get the sooner you will be treated, and everything is confidential. Um, for the wider youth population, we will promote some. We will promote our clinic and we do some media like infographic or video to promote. And influencers inviting to coming to our clinic to review our clinic. And our clinic is and the service is open. We don't have any stigma like what is your gender or you have high risk and you have to go to test and treat. We don't have we shouldn't do like that because if you do like that, anyone will not come to test to the clinic. Okay. Yes. Oh, okay. Finally, um, I I want to thank everyone who go the clinic to the adolescent clinic, and I and if you want to know more about us, you can. Okay.
You can contact
Yeah.
Tonpai if you want to learn more, or you have adolescent or youth in your clinic or your countries that would like to learn more and engage with our groups.
Okay. And you can visit us in the booth, which is in the front of this meeting room. Thank you. ขอบคุณครับ
Thank you so much. Thank you so much for sharing your thought and be empowered to come up and lead what service you need. Thank you so much.
ขอบคุณครับ
So I think the second part we would like to share about youth-friendly health service that we have worked with and also get support from the Division of AIDS, Ministry of Public Health to talk about some examples of what kind of youth-friendly health service that was built. Every service have a unique settings. For example, in Bangkok, we have Badisiu Clinic, which we will tell in more details. It's a concept of one-stop service that Tonpai mentioned. We have Standby You Clinic, is using the digital health to close the gap of inequity of accessing to health services. So it's a digital health that can be reached throughout Thailand. It's called Stand By You by Dr. Patariya from Mahidol University. And also in other provinces, we start to have KKB Friends in Khon Kaen, whereas the concept is love is all around. It was framed in a positive way. We don't have any words about HIV, STI, or risk, but it's talk about love and a safe space for adolescent to come in. And also another settings in Chiang Mai is New Gen Clinic and emphasize on the generation, emphasize on themselves, not on disease. So we talk about people center. So the Buddy Clinic is adolescent and young adult that was focused on client 15 to 24s. We have integrated both HIV testing, HIV treatment, and HIV prevention, mental health, psychosocial support, and also other sexual health such as STI and gender-affirming hormones. And like Thonpai mentioned, because they also help us to shape our clinic. So our clinic use the concept of one-stop, fast, service, friendly, free, and also it can also advertise through several campaigns, including the online that they can get appointment to us in the Love to Test platform. So our service was set up about 5 years ago, and we have more than 1,000 clients that come to our clinic. We have 163 clients that have started ART in our clinics, more than 600 start PrEP and HIV prevention package, about 250 that have come for HIV and STI testing, but they're not as high list as they need PrEP or they don't want to start. And we also have a mental health as integration part in our service, and also suicidal prevention, which I will discuss more on what is the mental health care. You might feel like mental health care is quite scary, you don't know what to do. We will tell you how we set up with the support from the Treat Asia and the Chimera programs, try to integrate this into the key component. As you remember, mental health is the first need from adolescent survey. And this year we just start to screen hepatitis C, and we just start learn how to test and treat hepatitis C in our clinics. 3% of our clients in our clinic living with hepatitis C co-infection. And also, we also empower them. We have a charity that work with us and support and empower them to be continuing to university education. So how to make it one-stop service? I think the key thing is that now we use point-of-care testing of HIV. Why we do point-of-care testing? Because we can shorten time and make one-stop service to not just one time for testing and one clinic for services, but bring it together as a point-of-care testing and then lead to same-day PrEP or same-day treatment. And also, I would like to show that this is the key game changer. When you use HIV self-test, it can be for adolescents to go out and teach your friends to use HIV self-testing, or have someone have HIV self-testing as a demand creation to really think seriously about their HIV risk and start to think about prevention. And how we engage adolescent. When we empower adolescent, we can ask adolescent to be the ambassador or the one who engage friends into the clinic. It's called social network strategy. Social network strategy is not social media. It's not partner testing. It means that when you get into clinic or services, you start to think about what is your friend or who will be benefit for the service that you already have. And then we ask them to be our recruiter, help them engage to think about a listing of who they would like to ask to come to get the service, like Thonpai mentioned. And then we have a process to help them to recruit their friends into the clinic. And in this slide, it's showing that each dot means each person. So you can see clearly that there are some recruiter that can recruit many friends into clinic. Importantly, 60% of adolescents who come through this way is the first time HIV test. So they can reach their friends and bring them into clinic. And we find 3% HIV prevalence, which is the threshold that is we need to do something to prevent them from acquiring HIV. And 1/3 start same-day PrEP because they have friends who already have services, already take PrEP to be accompany them and encourage them to get the HIV prevention services. And mental health screening, PHQ-9. I'm not sure anyone use PHQ-9 in your clinic. Please raise your hand. Oh, it's quite a lot. Maybe it was trained by Treat Asia, Dr. Annette. So the PHQ-9 is the tools to assess depressive symptoms and risk of self-harm. In Europe, you might use PHQ-2 that just asks 2 questions, little interest in doing things or feeling down. And if the maximum score is 3, 2 questions, the maximum score is 6. If you have 3 out of 6, you will trigger you to think or talk about mental health. But I think in adolescent, which is the period of high burden of mental health and also have a self-harm. So if you use PHQ-9, it will include other symptoms, which is how do you sleep, how do you eat, how do you have pleasure in life, and the last question, do you ever think about self-harm? So with this, we can start to triage and identify mental health problems. In our clinics, 13% of our clients have mental health issues, and 80% of them is major depression. However, 3.6% have ever suicidal attempt. it's not low, it's quite a number. And we need to empower ourselves and train our staff to be able to address mental health and also to deal with the suicidal ideation or attempt, which we have a great programs with Treat Asia on Chimera programs. So the keyword is that you need a consultation, you need a team to be trained to sensitize about mental health and also management of emergency plan if just in case they have suicidal ideation or thought. And also, we used the monthly meeting for patient management and staff empowerment. So this slide showing that when we start a program, when we detect any mental health problems or issues, we just refer 100% to psychiatrist team. However, it's not be sustainable. And also the adolescent feel stigma to have to send to psychiatrist. With the integration, right now, only 40% that have serious conditions or complex condition has to be referred to psychiatrist, but the rest was managed in our clinics. So how we build this one? I think the first important thing that you need to connect to clients. We have a camp that we empower them and also empower ourselves to go beyond our comfort zone, to integrated mental health, to integrated any services that is meaningful to our client. We learn and also we ask youth to lead and also work with us closely. I think that's the key that how we develop adolescent-friendly service in our programs. And the second one is on the digital health platform. That one is from Sirirat by Dr. Kantarida. She is the adult ID physician. And she just wondered why I got number of new cases come in and I have to treat opportunistic infection. And she realized that because the adolescent cannot access to test, cannot access to earlier treatment. So what she come up with her group is that she set up online platform which called Stand By You. You can see it's all positive frame, nothing about risk, nothing about HIV, but its aim is to reach and recruit young people to be able to assess their own risk. And if there has a threshold of risk, they can send the HIV self-test to them. And also if it's positive, it's linked to the health facilities. They provide chatbot counseling and also knowledge to adolescents. How many she can reach in 1 year? Let's guess. How many people you can reach in 1 year? So she just set up this program for about 14 months. She reached about 6,000 people, and half of them are youth. And the prevalence of HIV is 3.3%. It's quite concerning. And in her program, she can be able to link the positive screening to confirmatory tests in health facilities, and also 2/3 of them can start ART initiation. Without this digital platform, without reach out, she might end up having clients come in when they have low CD4. This is an example of how we mobilize them ourselves and try to design and try to reach adolescents, not ask them or wait for them to reach out to the services. That's the key of the working with adolescents. They are not hard to reach, but we are hardly ever reach facilities for them. So I think we give you some examples of what youth-friendly service in our client needs, some examples from Thailand. So now we come up with what we would like to learn from your settings. Please bring up your phone. Okay, so how do you plan to start or improve delivery of youth-friendly service in your country? So these questions will be combined. You can take your time, answer in the Menti in your mobile phone, or we have microphone. If you would like to share, ask, or tell us more about what is youth-friendly service in your country, you are very welcome. Please come to microphone while we are brainstorm. Oh, sorry. Please go to Menti. Okay, meanwhile, we are waiting for people to answer. Anyone would like to share your thoughts, ideas, please? We have 5 minutes to discuss sharing your thought or share your experience, please. Thank you. Please introduce yourself and your country that you work and then share your thought. Thank you so much.
Good morning. I'm Sheila. I'm a primary care physician from Malaysia. So I actually run a sexual health unit in a primary care center in Kuala Lumpur. So one of the challenges, I think my colleagues from the primary care would also assert the same, is the age of majority in Malaysia. So our age of majority in Malaysia is 18 years, meaning any adolescent less than that who comes to the clinic needs parental consent before care is given. So I'd like your opinion on that. That is a major barrier for us to extend care to the adolescents. Thank you.
So I think in Thailand, we frame this as sexual and reproductive health, and Thai Medical Council will around that sexual and reproductive health is a child right. They can access to the service that is benefit to them if they are 13 and 18, including reproductive health, contraception, HIV and STI. So I think if we talk about HIV, which has a lot of stigma and concern, we might need to frame that as part of reproductive health and child right that we can move along. It's just an approach that we did in Thailand, but I know that each settings and each countries have the barriers. But I think in your point is that structural barrier is the one that you have to deal with. Thank you. Any comments or suggestions? Thank you.
Yeah, my name is Dr. Bora from National HIV Program, ICI in Cambodia. And first, I thank you, Dr. Thanyawee, for your share a lot of experience and very excellent job. Actually, it's interesting that my country is not well dedicated for the youth-friendly service. So the concern is around the stigma and management. One thing is that I learned your presentation about the mental health. So it's different management with the HIV and not HIV patient. So how to manage on that? During you use the screening tool, it's a differently, or how to manage it after screening? Because stigma still inside. Thank you.
I think stigma when it's occur when you treat people differently. As we say that we will screen someone high risk. So whenever you make it a common thing, make it that everyone do it. So in our clinic, PHQ-9 is like body weight and height. You measure the growth, physical health, and also PHQ-9 as to assess their mental health. So everyone come to clinic will do it. So we not make it special, we not stigma for people to talk about it. And then give a message that we care about mental health as the first step to open the door for people to feel more comfortable to talk about mental health. Because I think mental health and reproductive health and sexual health is something that is in Asian culture. It's hard to talk frankly or open. So we make it routine to start to screen. Okay, and also the mental health issues, it's have a degree of severity. If something that is just occur because of the developmental stage of adolescent, we can use counseling, we can use safe space for them to talk and then work with them. But if they are moderate or severe, then we need a psychotropic drug to use in our clinic. And we also learn from psychiatrists and mental health team to train us how to use it safely in the clinic. So I think the first thing for mental health is to talk about it. Let's talk, because we know that the statistics around the world is the same, that in adolescent period, about 5% will have mental health issue that they would like to be addressed or talk about. So this is very interesting. So what do you plan to improve or start youth-friendly service in your country? One-stop service. So Tonpai, your model, it's work. Everyone will accept your model, one-stop service. They would like to also have youth advisory boards and also make out of our services, advocate for youth rights, training for staff, free services for youth, point of care testing. Hopefully, this session, when we talk about adolescent, the reason that we talk because we know and we care about adolescent, that half of the new infection occur in adolescent in this region. Everyone know why. What we need? Tonpai tell us they need youth-friendly service. Because they need safe space, they still need times to grow, and they need to feel relaxed and accepted. So we cannot just ask them to go to the existing service, go to the treatment centers, go to the PrEP centers that have many people that will ask, you are so young, why you come here? That first, my small talk or greeting just push them away. And then the last one, we know why we need to do this, what we're gonna do. The last one is how. I think everyone needs to answer in your settings. And hopefully these sessions can help you to be advocate and start action for adolescents. Thank you so much.